Associate needed in New Jersey, a state near and dear to my heart. That was where I do the majority of my dentisting. I am here with my friends, fellow DSN, DSI members. So share with us, my two friends, who you are and why are you looking for an associate dentist?
Yeah, I'm Brian, and this is Heather. So we have an office in Warren County, New Jersey, about 20 minutes from the Pennsylvania border. If you know where Easton is, we're directly east of Easton, Pennsylvania. Um, why we're looking? Because we're going crazy. We moved
Nacho
from a four,
nuts. You're going
nacho
nacho
nuts.
nuts. This
So
is
we
how
moved
you
from a
feel on the inside part of your body each day, right? This is the feeling
yes,
you have on the inside part of your body.
yes, that's
Well, it's not
exactly
going
how we.
crazy. I like to hear that. You guys, what does going crazy mean there? This is for educational purposes too. How long you been
Sure.
a practice owner, Brian?
8 years. 8 years,
Eight,
February 1.
8 years. And Heather, what do you do in the practice?
So I am the business manager and I am a dental hygienist. I fill in everywhere that I am needed, which happens to be
Head
everywhere.
referee, traffic controller, all those.
Yeah.
Exactly, exactly.
Um,
So why are
we
you going
moved from
nacho nuts?
we moved from a four-op practice, four-op location. We built out an eight-op location. Went from two hygienists to three, and averaging 30 to 34 new patients a month. And now we're doing about 70 to 80. We hit, I think, 91 1 month in the 4 months, 4.5 months we've been here. So,
So, like
average,
Dennis P. Diddy said, too many patients, too many problems, right? There is
correct,
such
correct.
thing as I think when we're in dental school, we think there could never be too many patients, and you guys are living, even if you're successful with your production, and even if you're successful delivering care, you have too many patients and you need some help.
Correct.
And we are
Correct.
here to get you this help. So, what I'm going to do is I'm going to play the role of someone asking about your job, and you guys share with me. So, we've talked about why you need an associate. We've talked about where is the position in the great state of New Jersey, where I am from. Tell me about what procedures will I be doing most of the time? Hey, guys, I work with you full time. It's 4 days a week. What procedures will I be doing most of the time?
We're a bread and butter office. I'm getting more involved in surgical extractions, grafting, and implants. But we definitely have room for if you're interested in it. I'd love to help you learn how to do it predictably, especially the extractions. Because I'm just getting involved in my implant journey. We do some Invisalign here, endo. We're trying to keep as much as we possibly can in house. So obviously crown bridge, not bridge, Paul.
Yeah.
Implants.
Don't make me break out in hives. I already told you I have something fun to do tonight. So don't ruin it by thinking that I got to think of two teeth screaming as you just tear off all of their enamel, right? It's like bloodletting. Oh, we need to replace one tooth. How about we ruin two teeth in the process to do it? So
Sounds like a plan.
I'm proud of you. Implants, I do refer to them as notches. So they're able to do
Yeah,
fundamental restorative procedures, but then
yeah,
also get mentored by you. Now,
correct.
when did you graduate from dental school, Brian?
I graduated in 11.
2011, I was 2002. So the cost for dental school continues to be nacho nuts. It is
Yeah.
out of control. So let's say I'm a dentist, say, okay, listen, that sounds great. I like New Jersey. You guys seem fun. I can do these things. But just talk to me about if I'm going to tell my wife I'm going to take this job or my parents, the compensation. How will I be compensated and what kind of range could I expect?
Sure. So we're offering 30% of adjusted production, and a guarantee for of $600 per day. Um, I think the range, it's really what you put into it. I think between 150, 175 on the low end, and as high as you and your skill set and your desires kind of want to take you.
And one of the things I'll share as someone who lives this life daily, has been in this life, has associates, is that associate dentists need to be patient with their patients. And I know that's kind of a funny way to say it, but as you develop more relationships, I was just speaking with my associate dentist who's been with us for 3 years, and she's now developing relationships and able to produce more because they know her. And when you get into a practice, you have a daily safety net guarantee, which is awesome because, you know, these entitled new dentists, Brian and Heather, they're very entitled. I've heard a lot of them like to eat food and have shelter. How entitled can you be in your life if you want food and shelter? So it's super reasonable to want to a security of knowing that I'm going to earn enough money to pay my loans or with the opportunity to earn more in your practice. So the other thing I want to ask you is, let's say I'm a 30-year-old dentist. I'm coming to work with you guys. This all sounds good. Outside the operatory, dentists are people too, I say. So what are some fun things that you would do if you lived in your area?
What would I do if I live in my area?
Yeah.
Well, if you're into hunting, there's a lot of hunting around here. If you're into just, you know, fishing, there's a lot of good rivers that folks fish around here. It's pretty rural, not super duper rural, but, you know, adjacent to my office is a cornfield.
Wow.
You know, but we're 5 minutes from the center of a small town, and like I said, Easton and Phillipsburg are 20 minutes away, and those are, you know, sizable smaller cities.
Restaurants, bars, things like that.
Bars, stuff. Lafayette
Festival.
College is right there. Easton has tons of like she said, festivals.
I like
A lot
that.
of cool things.
I'm like Jim Gaffigan. I'm an indoorsy person, right? Everyone's always talking about the outdoorsy stuff. Where's the sitting and the eating? And it sounds like it has both there. And still, you know,
for sure.
You're part of this area where you guys came to Philadelphia to one of my courses, which was great. So you're in an area, you know, where PA, New Jersey, New York, Washington, D.C. So, I mean, I really applaud you guys for building a practice where you have this need. People can go to dentistjobconnect.com. They can text New Jersey to 215-798-9897. But whether it's Heather or Brian, anything else you'd like to share with our audience about your practice, your culture, being part of DSI, DSN, how does that help you guys? Anything else you'd like to share?
You know, we're growing. We're trying to do it the right way. We do regular CE. We just took the team to
Maryland.
Yeah, to Maryland for a CE course, case presentation, treatment planning type course, which was really, really good.
Shout out to Chris Bowman.
Yeah, Chris Bowman.
right,
He's a
Chris.
nacho sponsor now. Yeah.
Yeah.
Check Chris
That's right.
Bowman, Mark Costas. Yeah. We are doing his thing. So that's
awesome.
Yeah, awesome CE.
Course.
So even if you don't want to work here, I definitely recommend you take the course. It's really, really it's really beneficial, and it's in the month essentially that we've been utilizing. I think we've really grown leaps and bounds.
That's awesome.
Could you repeat the question, Paul?
I was just saying, anything else that I know what happened to you. This is so authentic. You've been dentisting all day. You've been keeping your sweating on the outside. You're crying on the inside. You said, I just want to know if there's any other toppings in the nacho world, as we say, that you wanted to share, but you already shared how you invest in CE for your team. You invest in your culture. Anyone who's part of DSI and DSN, I think, is just phenomenal. Mark is a great friend and sponsor, and I love being part of it with my practice. And it shows that you have a growth mindset that people can come in and they don't have to worry about running the show. They can be part of your show.
Yeah, no, it'd be a good time. Good time. It's we cry sometimes, but you know, they're tears of joy, right?
Well, unlike baseball, there's plenty of crying in dentistry. So, well, thanks so much. You guys stick around with me. I want to share with you. These are my awesome friends, Dr. Brian and Heather. They're in New Jersey, just like me. Go to dentistjobconnect.com to apply to their full-time position with mentorship, or text New Jersey to 215-798-9897. Thanks, guys.
See you later. Thank you.